I don't think there's a man or a woman out there that doesn't want a well-defined jawline and neck. So let's say we have somebody where their skin tone is still pretty good, the muscle's nice and toned, but they just don't have a very good jawline. Well, that means there's probably a deficiency of the actual bony structure. So surgically, you can certainly do a chin implant, that can be great, or you can augment the form with either fat transfer or fillers. So for that type of patient, that's going to give a really good result. Now, let's say it's really a matter that it's just in some people, there's a lot of fat right under the skin, often right in this area under the chin. And if the skin's good, and if the muscle's good, simple liposuction, a short procedure, local anesthesia, you get amazing changes. So then let's look at the patient where the skin's still pretty good. This may be just starting to lose its tone, but early, but it's that underlying muscle. This is actually much more common than people realize. A lot of people think it's their skin, but it's really the muscle. So if it's just the muscle, the skin's not super loose, then there's a procedure called MyEllevate, which we can use. And that's kind of neat because you don't make the traditional incisions around the ears like we would with a neck lift, but you can make tiny little openings and use a fiber optic system. And we do two things. We cut the muscle where it's formed these tight bands, and then we weave a supporting hammock, if you will, and that really crisps up the jawline, again, just under local anesthesia, but a surgical procedure. So let's move forward now to somebody where skin is loose, muscle's loose. Now we're really in the situation where we need to do a surgical procedure, either what's called an isolated neck lift, or it really is just down here, or a neck and jaw border lift, one of our favorite procedures in my practice, usually combined with fat transfer, almost always under local anesthesia. Now, in order to get the proper vectors and shift things, we're going to make incisions around the ear, a little in the sideburn, etc., come underneath and work at that next layer to simply reposition it to the natural position of that individual. So make the right diagnosis, do the right treatment, go to somebody who is highly knowledgeable and understands all these things, and you'll probably get a great result.